Assalamualaikum and greetings to all. I'm Dr. Nur Nadira Misrang from Primary Care Medicine of UITM. I'm presenting a poster entitled Assessment of Asthma and COPD Care Practice in University Primary Care Clinic. As we all know, asthma and COPD are the common obstructive pulmonary diseases encountered in primary care. Therefore, it is crucial to deliver the best quality of care for them. The aim of this study is to assess the current practices in delivering asthma and COPD care in our UITM primary care clinic and compare it against the recommended practice guideline. We conducted the study by selecting the care standards for structure, process, and outcome based on the latest guidelines, namely the GINA 2020 CPG Management of Asthma in Adult, Goal 2020, and the NACAP Primary Care Queries Royal College of Physicians 2018. The patient's data from January to December 2020 were extracted from the EMR system using ICD-10 codes for asthma and COPD. We include all the asthma and COPD patients who attended our clinic follow-up for at least twice in a year, and we exclude those who have follow-up for asthma and COPD in other facilities. The data were then analyzed and compared to the audit standards. Total of 180 asthma and 15 COPD patients records were selected. Majority were female in asthma and male in COPD. The mean age for asthma is 54.6, while the mean age for COPD is 73.6. Most of the structure of care standards were achieved, which include the availability of the self-management booklet, the availability of the peak flow meter in each consultation room, and the availability of different types of inhaler therapy in our clinic. With regards to the process of care standards, two items were achieved, which are the documentation of ACT score and the documentation of treatment adherence. However, in COPD, all the standards set were not achieved. As for the output of care standards, we managed to achieve high percentage of good asthma control, which account for 78%. However, percentage for influenza and pneumococcal vaccinations were not achieved. From this audit, there are few recommendations that we suggest. They are to set up an asthma or COPD clinic registry, to provide dummy inhaler in clinic, to encourage inhaler technique assessment by doctors, and to implement a checklist template for a better documentation. As for a conclusion, this audit has become an eye-opener towards a better practice in future and to deliver the best quality of care in asthma and COPD patients. Thank you.